Hello everybody, this is Dr. Gopi. Today it is session 2 of ICU Nursing Orientation program. The topic today is infection prevention. Today we will discuss deep into hand hygiene, PPE, bundle care for sepsis or infection prevention. Clean hands saves lives. It's a very important quote by WHO. We will get into the importance of hand hygiene in this topic. In relation with NABH 6th edition, the HIC, which was previously known as Hospital Infection Control, is renamed as IPC, Infection Prevention and Control now. It enlists a number of things. They includes PPE list redefinement. The term apron removed from the PPE list. The standard PPE now contains hand hygiene, gloves, mask, gown and eye protection. The PPE elements merged. Former HAC 2A and former HAC 2B are now combined into a single object element for clarity. An SSI bundle added. The surgical site infection prevention bundle is now explicitly required. The pre-op antimicrobial prophylaxis, normothermia and glycemic control are a crucial part of SSI bundle now. The antimicrobials replaces antibiotics throughout. It reflects the stewardships of antibacterials, antifungals and antivirals, collectively called as antimicrobials now. And CSSD recall mock drill. Periodic mock drill of the recall procedure of CSSD is now required. And the surveillance streamline. Former HAC 3F and HAC 3G are merged, and the surveillance covers hospital-acquired infection, hand hygiene complaints, and MDR organisms. So why infection prevention matters? The Healthcare Association infection are largely preventable, and the ICU is the first starting point, which is level 0. Around 30% of ICU patients in lower middle class income category acquire more than 1% of hospital acquired infection as per WHO. Around 5 to 10 times higher risk of hospital acquired infection in ICU in compared with general ward. Around 59.6% global ICU hand hygiene complaints, which is too low. We need to increase this number. And up to 50% of hospital-acquired infection reduction with proper hand hygiene. The 4 device or procedure-related hospital-acquired infection we target are bundles. They include VAP bundle, which is ventilator-associated pneumonia bundle, and CLABSI, central line associated bloodstream infection, and CAUTI, catheter-associated UTI, and SSI, surgical site infection, which given importance in NABH 6th edition. As per WHO, the 5 moments for hand hygiene, it's a gold standard global standard that includes before touching the patient, it protects the patient from your germs, and before clean or aseptic procedures, it protects patients from their own germs, and after body fluid exposure risk, it protects you and the environment, and after touching a patient, which protects you and the environment, and after touching patient's surroundings, it protects you and the environment as well. So how to do it, the technique and time. There are 2 different methods and 2 timing, and both covers all surface of both the hands. The first one is alcohol based hand rub, which needs to be done for around 20 to 30 seconds and hands not visibly soiled most of the ICU moments, which is preferred method. So apply a palm full of alcohol based hand rub, and it covers all surface, and rub palm to palm and right palm over the left dorsum and interlaced fingers and vice versa, and palm to palm with fingers interlaced, back of fingers to opposing palms, rotational rubbing of each thumb and rotational rubbing and clasped fingers in palms. Once dry, the hands are safe and free to use again. Regarding the soap and water hand wash, it needs to be done for about 40 to 60 seconds. Whenever the hands are visibly soiled after toilet use or suspected Clostridium difficile spore-forming organism. Steps includes wet hands with water, apply enough soap to cover all the surface, same 7 friction steps as alcohol rub, rinse with water, and dry thoroughly with single-use towel and use the towel to turn off the tap. Now the hands are free, now safe to use. Next, we'll discuss about the PPE donning technique. Putting it on. The sequence matters. First, you do the hand hygiene, alcohol rub for 20 to 30 seconds, clean the hands before anything. Next, wear the gown, tie at neck and waist, covers torso to knees, arms to wrists, and use the mask and N95 respirator. Cover the nose, mouth, chin, N95 to prefer fit and seal check. Next, the eye protection, goggles or the face shield, adjust to fit. Next, the gloves. Pull over the cuffs to the ground. Inspect for the tears. Once gloved and gowned, do not adjust mask or eye wear with the gloved glands. Once gloved and gowned, do not adjust mask or eye wear with the gloved hands. Plan your task before entering. PPE doffing, the risky part. So most self-contamination happens here. So slow down and follow the sequence. First, remove the outer glove, which is fully contaminated. Peel one glove off and keep one glove in. Next, use the hand hygiene technique. Next, remove the gown and the hand hygiene technique again. Next, remove the eye protection, mask or respirator. Final, the hand hygiene technique again. VAP bundle, so ventilator associated pneumonia prevention. So it is evidence-based bundle and there are multiple elements needs to be checked in every shift and every patient. So head and elevation needs to be kept between 30 to 45 degree and daily sedation interruption and spontaneous breathing trial assessment, stress ulcer prophylaxis, hand hygiene before and after ventilator care, which is non-negotiable, and oral care with chlorhexidine 0.12 to 0.2 percentage every 4 to 6 hours, which reduces the oropharyngeal load, and DVT prophylaxis, pharmacological and mechanical as indicated, and cuff pressure, ET tube cuff pressure of 20 to 30 centimeter of water, which needs to be checked in every shift, prevents microaspiration, and finally subglottic secretion drainage while available for ventilator more than 48 to 72 hours. Regarding CLABSI and CAUTI bundles, so CLABSI is central line associated bloodstream infection bundle, which includes hand hygiene before insertion and every line access, maximum barrier precautions using cap, mask, sterile gown, gloves, full body drape. Next, the chlorhexidine 2% skin antisepsis. Allow it to dry, do not wipe off. An optimal site selection. A subclavian or interjugular is preferred over the femoral. Daily review. Remove as soon as possible. Every line, every day. Do they still need this? That question should be there in mind. Regarding the CAUTI bundle, which is urinary catheter. Insert only if indicated. In some cases like acute retention, accurate intake-output assessment, critically ill patient, or post-op patients. And aseptic technique is required. Sterile technique, sterile equipments, and 2% check. And maintain closed drainage. So below the bladder level to be kept and never disconnect unnecessarily to avoid the exposure to outer organisms. And secure the catheter and daily meatal care is essential. Soap and water is needed. No routine antiseptic ointment is necessary. Daily review and remove as soon as possible. So whenever it is not needed, immediately remove it as quick as possible. In the SSI bundle, surgical site infection. As per the new NABH 6th edition requirement, SSI bundle become mandatory. In pre-op patients, the antibiotic prophylaxis, the dry drug and dry dose given within 60 minutes before incision, 120 minutes for vancomycin or fluoroquinolones. And hair removals needs to be done with clippers, not the razors. That too only if needed. So razors can cause microabrasions and increases the SSI risk. Pre-op skin antisepsis. Chlorhexidine-based alcohol is preferred over betadine. Allow to dry it fully. Do not wipe out. Intra-op, maintain normothermia. The temperature should be more than or equal to 36 degrees centigrade, and active warming and hypothermia impairs immunity and wound healing. Regarding the glycemic control, the sugars needs to be maintained between 140 to 180 milligrams per deciliter for both diabetic and non-diabetic patients. Avoid hypo or hyperglycemia. In post-op, aseptic wound care and early dressing review. First dressing change at 24 to 48 hours unless soaked, and hand hygiene during every contact. Regarding the isolation precautions in the ICU, the standard precaution is used for everyone and transmission based when indicated. There are 4 different isolation precaution protocols. One is standard, contact, droplet, and airborne. The standard is used for every patient every time. The hand hygiene, gloves when contact with body fluids, mask and eye protection if splash risk. It is used for all routine ICU patients. For contact, for MRSA, VRE, Clostridium difficile, ESBL, CRE, and scabies kind of cases. To be used gowns, gloves on entry, and dedicated equipments, single room or cohort. So diarrhea with Clostridium difficile suspicion is a classical example. Regarding droplet, influenza, meningococcus, pertussis, and RSV. Surgical mask within 1 meter and single room preferred. Patient wears mask during transport, so no febrile cough on ventilator vane. Regarding airborne, the TB, measles, varicella, and COVID-19 types. So N95 and FFP2 masks are preferred, along with eye protection. Negative pressure isolation room is preferred. Doors has to be kept closed. For example, sputum positive PTB, intubation of COVID-19 patients. So the key takeaway of this session that includes in NIBH 6th edition, the hospital infection control has been renamed to infection prevention and control, and the term antibiotics has been replaced with antimicrobials throughout. Hand hygiene is the single most effective hospital-acquired infection prevention measure. Practice WHO 5-moment hand hygiene technique in every shift. Alcohol-based rubs 20 to 30 seconds when not soiled, and soap and water-based rub 40 to 60 seconds when soiled or after Clostridium difficile. Regarding PPE, gown, mask, eye protection, and gloves. Apron is no longer a part of standard PPE in NIBH 6th edition, and apply VAP, CLABSI, and CAUTI, the new SSI bundle, as all or nothing. Partial compliance is also not equal to compliance. Review every line and catheter daily. Does this still need to be in? This is the question MCQs. Pause here. Try to answer all these questions in the comment section. I'll be happy to read your answers. Thank you. The next section will be about vital signs, early warning scores, and patient assessment. Hope I will be seeing you in the next session. If there is any questions or if you want to discuss about anything, please post your content as a comment. Thank you. Bye.